Ms. Ameera Shah, who's going to talk about diagnostics.
Thanks, Rupali. Just a quick show of hands. How many people here gave a blood sample in the last 1 year? Anybody? How many people here knows what happens to a blood test after you've given a sample? Anybody? So you're not the only ones. Unfortunately, in our industry, in diagnostics, majority of people have no idea what actually happens after you give a blood sample. Because everything is behind the scenes. It's something you can't touch and feel. It's something that you don't know what's happening. And you just assume that the report that you get is correct. Because you think, okay, I'm paying for it, it must be an accurate report. Unfortunately, that assumption is a little bit incorrect. You know, diagnostics in a lot of ways is the underdog of healthcare. I'll tell you why. Because pharmaceuticals, health insurance, hospitals have been now around and consolidated as an industry for quite a long time. They're quite sizable. So even as health journalists, all of you know quite a lot about these industries. Diagnostics is an industry which is now completely a sunshine sector. It's only developed in the last 10 years. I mean, I started building this business only in 2002. And it's really grown, and we've been one of the first leading chains to make it into a chain. Otherwise, all were individual path labs. So this industry is very new and very nascent, so most people actually don't know what happens behind the scenes. Let me give you a little bit of information about it. There are estimated to be about 50 to 75,000 laboratories across the country, and truthfully, we don't know the number. This is all guesswork. Out of these 50 to 75,000 laboratories, 99.9%, nobody knows what happens behind the scenes. The reason is because there are only 300 labs which are actually accredited in any way. The government, we actually don't fall under any government ministry or any governmental regulation. So as we talked about health insurance, which was highly regulated, for a path lab, you don't need any regulation. So tomorrow, if any of you, by the way, are tired of being health journalists and you decide path lab industry bahut paisa hai, anybody can start a lab. There's absolutely no requirement, which, as you can imagine, is really scary. Because that means that 99.9% of labs that you walk into, and when you give a blood sample and you're hoping for a right report, the truth is nobody knows what happens. Nobody knows. And I'll tell you, there's a common knowledge in our industry where the urine test is called the sink test. Why? Because they take the urine sample in some labs, pour it down the sink, and give the same report to everybody. Nobody's checking. So, everybody tries to cut costs as much as they can. There are only, out of the 300 labs which are accredited, this is voluntary accreditation. So only if you say, I want to check myself, you can go apply and somebody will come and check you. And as you know, normally the people who say, please come and check me, are usually the ones who are following the protocols. So you can imagine what's happening in the rest.